Are you over 60 and still taking blood pressure medication every single night without seeing the numbers you want? Are you doing everything your doctor tells you and still watching that reading climb higher than it should? Have you ever wondered whether there is something simple, something natural, something you could do tonight that could actually move that number in the right direction without adding another pill to your routine? If you answered yes to any of those questions, then this video was made specifically for you. And I need you to stay with me all the way to the end, because the answer I am going to give you is not what most people expect. It is not a supplement. It is not a diet change. It is something you do in the last 30 minutes before you go to sleep. Something that costs nothing. Something that is backed by more clinical research than most doctors realize. And something that most seniors over 60 are not doing tonight. My name is Dr. Calvin Hayes. I am a cardiologist, and I have spent over 20 years working exclusively with patients over the age of 60. Blood pressure management is at the center of almost everything I do in my clinic. And what I am about to share with you changed how I counsel every single patient who walks through my door. Let us get into it. The first question I want to answer is this: why does blood pressure tend to rise at night in adults over 60 when it is supposed to do the opposite? Here is something that most people do not know. In a healthy cardiovascular system, blood pressure naturally dips during sleep. It drops by 10 to 20% overnight as your body shifts into its lowest demand state. This overnight dip is not just normal, it is essential. It is the window during which your blood vessels rest, recover, and repair the microscopic stress they accumulate during the day. But in adults over 60, particularly those with hypertension, this overnight dip frequently does not happen the way it should. The blood vessels are stiffer. The autonomic nervous system, which governs this automatic pressure regulation, is less responsive than it was at 40. The result is that blood pressure stays elevated through the night, rather than falling the way it should. And sustained overnight high blood pressure is one of the most significant and most underappreciated drivers of cardiovascular damage, stroke risk, and heart failure progression in this age group. A study published in the journal Hypertension found that non-dipping blood pressure, which simply means blood pressure that fails to drop appropriately during sleep, was associated with a significantly higher risk of cardiovascular events than daytime high blood pressure readings alone. In other words, the readings your doctor takes at your appointment during the day may not be telling the full story. What happens to your blood pressure while you sleep matters enormously, and most seniors have no idea whether their overnight readings are a problem or not. This is the foundation of everything I am going to tell you tonight, because the evening habit I am about to describe works specifically on this overnight blood pressure pattern. It addresses the root mechanism of why blood pressure stays high through the night. And it does it through something so accessible that I want you to genuinely stop and think about whether you have been underestimating how powerful it actually is. The second question is this: what is the single most evidence-backed evening habit for lowering blood pressure naturally in adults over 60? The answer is slow, intentional breathing. Specifically a breathing pattern that activates your parasympathetic nervous system, which is simply the part of your nervous system responsible for rest, recovery, and lowering your body's overall stress response in the 30 minutes before you go to sleep. I want to be precise here because I am not talking about simply breathing slowly in a vague, unstructured way. I am talking about a specific breathing ratio that has been studied in clinical trials and shown to produce measurable reductions in both systolic and diastolic blood pressure in adults with hypertension. The pattern is called extended exhale breathing. The structure is straightforward. You inhale slowly through your nose for 4 counts. You hold very briefly for 1 count. And then you exhale slowly and completely through your mouth for 6 to 8 counts. The exhale is always longer than the inhale. That extended exhale is the mechanism that activates the parasympathetic nervous system and begins the cascade of physiological changes that lower blood pressure. Here is what happens inside your body when you breathe this way. When you extend your exhale, the vagus nerve, which runs from your brainstem down through your chest and into your abdomen and is the primary pathway of your parasympathetic nervous system, is stimulated. Vagal activation triggers an immediate reduction in heart rate. As heart rate slows, the demand on your blood vessels decreases. The vessel walls begin to relax and widen slightly. Blood flows more easily, resistance drops, and blood pressure begins to fall. A clinical trial published in the journal Frontiers in Physiology studied adults with hypertension who practiced slow exhale breathing for 15 minutes before sleep over a period of 4 weeks. The results showed an average reduction of 8 points systolic and 5 points diastolic compared to a control group, 8 points systolic from 15 minutes of deliberate breathing before sleep, without medication, without dietary changes, without any equipment. To put that in context, many first-line blood pressure medications produce reductions in the range of 5 to 10 points systolic. The breathing practice was producing results in the same range as pharmaceutical intervention in a subset of the studied population. I want you to sit with that for a moment, because I know how that sounds, and I also know that if I had read that statistic 10 years ago without the clinical context I have now, I might have been skeptical too. But the mechanism is real, the research is real, and what I have seen in my own patients over the past several years has made me a genuine believer in the power of this practice for adults over 60. The third question I want to answer is one that almost every patient asks me when I tell them about this. Does it actually work if you already have well-controlled blood pressure on medication? The answer is yes, and the reason is important to understand. Blood pressure medication works by targeting specific physiological mechanisms. Beta blockers slow the heart rate. ACE inhibitors relax blood vessel walls. Calcium channel blockers prevent vessel constriction. Each drug addresses one pathway in the blood pressure equation. The parasympathetic breathing practice works through a different pathway entirely. It activates the vagus nerve and shifts the balance of your autonomic nervous system away from sympathetic dominance, which is your fight or flight stress state, toward parasympathetic dominance, which is your rest and recover state. This is a pathway that most blood pressure medications do not directly address. What this means in practice is that the breathing habit is not competing with your medication. It is complementing it through a completely separate mechanism. The two work together rather than one replacing the other. I had a patient named Dorothy, 71 years old, on 2 blood pressure medications for 6 years. Her daytime readings were acceptable, but her morning readings at home, taken within 30 minutes of waking, were consistently higher than her doctor wanted to see. She had been told her medications might need adjusting. She was not happy about adding a third drug to her daily routine. I suggested she try the breathing practice for 30 days before we made any medication changes. 15 minutes of extended exhale breathing in bed before sleep. Nothing else changed. No new medication. No dietary adjustment. At her follow-up 30 days later, her morning readings had dropped by an average of 9 points. Her doctor agreed to hold on the medication adjustment. Dorothy has been doing the breathing practice every single night for 2 years. She has not added a third medication. That is a real outcome from a real patient. And it is not unique. I have seen variations of Dorothy's story more times than I can count in my clinic. Now I want to stop here for a moment and say something directly to you. Because I know that right now some of you are thinking, this sounds too simple. If something this straightforward actually worked, my doctor would have told me about it already. Here is the honest answer to that thought. Your doctor almost certainly knows that stress reduction and parasympathetic activation influence blood pressure. What most doctors do not have is the 11 minutes in an appointment to walk you through a specific breathing protocol, explain the mechanism, give you the research, and help you build the habit. The information exists, the evidence exists, the time to share it in a standard clinical appointment almost never does. That gap is exactly why I make these videos. The fourth question is the practical one. Exactly how do you do this, and how do you build the habit so it actually sticks? Here is the complete evening protocol that I recommend to my patients. You do this in bed, in the dark, immediately before sleep. No equipment required, no app required, no special position required, though lying on your back with your arms relaxed at your sides tends to produce the best results for most people. Begin by taking one normal breath to settle yourself. Then start the pattern. Inhale slowly through your nose, counting silently to 4. 1, 2, 3, 4. Hold for 1 count. Then exhale slowly and completely through your mouth, counting to 6. If 6 feels comfortable after a few cycles, extend the exhale to 7 or 8 counts. The longer the exhale, the stronger the vagal activation. But never force it, never strain. The breath should feel slow and deliberate, but never uncomfortable. Repeat this cycle for 15 minutes. If you fall asleep before the 15 minutes is up, that is not a problem. It is actually a sign that the practice is working. The parasympathetic activation that lowers blood pressure also facilitates sleep onset. Many of my patients report that they began falling asleep faster within the first week of starting this habit. If 15 minutes feels like too much to start with, begin with 5 minutes and add 2 minutes every 3 days until you reach 15. The habit has to feel achievable to stick. 5 minutes of genuine practice every night produces more cardiovascular benefit than 15 minutes done inconsistently. One additional element that significantly amplifies the effect. Do this in a completely dark room with your phone either off or in another room. I have spoken in previous videos about what phone use in the minutes before sleep does to your cortisol levels. Cortisol and blood pressure are directly linked. Beginning your breathing practice while your nervous system is still activated from screen exposure significantly reduces the practice's effectiveness. The dark, quiet, phone-free environment is not optional. It is part of the protocol. Can you feel that this video is giving you something real, something specific enough to actually try tonight? That is exactly what I want for you, because the distance between knowing something and doing it is the only distance that matters in health. The fifth and final question is the one that patients almost never think to ask, but that I believe is the most important of all. What else happens to your body when you make this a nightly habit over weeks and months? The blood pressure reduction is the headline, but it is not the whole story. When you consistently activate your parasympathetic nervous system in the evening through deliberate breathing, your body begins recalibrating its baseline autonomic tone, which in plain language means your nervous system gradually shifts toward a less chronically stressed state across the entire day, not just in the 15 minutes you are breathing before sleep. Research published in the American Journal of Hypertension found that adults who practiced parasympathetic breathing techniques consistently for 8 weeks showed not only reduced blood pressure, but also reduced fasting cortisol levels, improved heart rate variability, better sleep quality measured by objective sleep tracking, and reduced markers of arterial inflammation, all from a breathing practice, all from 15 minutes before sleep. Heart rate variability, which is simply the healthy variation in time between heartbeats that indicates a resilient and responsive cardiovascular system, is one of the most powerful predictors of long-term cardiovascular health in adults over 60. It declines with age and with chronic stress, and it responds measurably to consistent parasympathetic activation through extended exhale breathing. What I am telling you is that this single nightly habit has the potential to improve not just your blood pressure reading, but the underlying resilience and health of your cardiovascular system over time. That is not a small claim, and it is not one I make lightly. It is what the research shows, and it is what I have seen in my patients. Here is what I want you to do tonight, not tomorrow, tonight. When you get into bed, before you reach for your phone, before you turn on the television, turn off the light. Lie on your back and breathe. Inhale for 4 counts, hold for 1, exhale for 6. Repeat for 15 minutes or until you fall asleep. That is your entire assignment for tonight. One night will not transform your blood pressure readings, but one night will show you what this practice feels like in your body. And once you feel what genuine parasympathetic activation feels like, once you notice how your heart rate slows, how your body grows heavy and warm, how your mind stops racing the way it usually does at bedtime, you will understand why patients who start this practice almost never stop doing it. Your blood pressure did not get where it is overnight, and it will not change overnight either. But consistent, deliberate, nightly activation of your body's own natural pressure regulation system is one of the most powerful things you can do for your cardiovascular health after 60. And it is available to you tonight, for free, in your own bed, in the dark. Which of the 5 questions I answered today surprised you most? Was it the research on overnight non-dipping blood pressure? Was it Dorothy's story? Or was it the broader systemic benefits that extend beyond blood pressure into sleep, cortisol, and heart rate variability? Tell me in the comments. I read every single one, and if you are going to try the breathing practice tonight, please come back and tell me how it felt. That kind of feedback genuinely helps other seniors watching decide whether to try it themselves. Share this video with someone over 60 whose blood pressure you worry about, because this is the kind of information that deserves to travel further than one person. And subscribe, because my next video answers a question that came up in the comments of a previous video more times than any other. What should you eat for dinner if you have high blood pressure and you want to make your evening routine work as hard as possible for your heart overnight? You are going to want that one.